Welcome back to CTV News Channel. I'm Jennifer Burke. As provinces across Canada continue to battle the second wave of the virus, vaccines are top of mind. To help us sort through the many questions we all have, let's bring in CTV News medical specialist Dr. Marla Shapiro for Ask the Doctor. She joins me from Toronto. Hi, Dr. Marla.
Morning.
So, people are starting to get vaccinated in the UK today. How soon do you think Canada and the US, because they seem to be moving in lockstep here, will get the go-ahead?
Well, the FDA today has done the preliminary release of the documents, giving us more information about the vaccine. Exciting news that showed that with the Pfizer vaccine, we saw immunogenicity and antibody response within 10 days. The idea of the second vaccine at 21 days is to give longer sustained immunity. And the vaccine also seemed to work regardless of ethnic, age, or even obesity. So those are some of the preliminary news that is breaking, just coming out this morning. So it looks as if we're listening to our politicians, that we're weeks away, days away from seeing the vaccine being released to that particularly high-risk population as we expect.
Let's look at who gets it first, Dr. Marla. I know we have a board. Tell us about this.
Well, I think, what we're focusing on is the fact that those that are at the highest risk are the elderly, long-term care, and the people who care for them in long-term care. So that's likely the group that we're seeing, as you saw today, this 91-year-old in England, the first woman who got the vaccine, an 80-year-old male who got the vaccine. I think you're going to see the same type of strategy here. And then I think we'll be looking at healthcare workers. We really want to try and unburden the healthcare system as much as we can. And we know that the elderly are at the highest risk of untoward outcomes.
Okay. So we need to prioritize those people, no question. Is there enough vaccine, the Pfizer vaccine, to do that? Or will this be staggered? We know there's a Moderna vaccine around the corner. We know the AstraZeneca one is still undergoing trials. There's J&J. The Canadian government has, bought into, I think it's between 5 and 7 companies that will be providing a vaccine. Right. Each is different, but each hopefully has the same result. But does this mean not all Canadians will be getting the Pfizer vaccine?
Well, I think we're going to see a variety of vaccines on the market. But as far as a messenger RNA vaccine, this is a synthesized vaccine. It's made in a factory as opposed to having to be grown in large cultures, for example, as live virus vaccines do. So the sense is that this can be ramped up fairly quickly. And not only millions, but billions of doses can be synthesized within factories to make the messenger RNA. And then it's a question of the distribution. So we have these first 2 messenger RNA candidates, which have given us, very good data, very reassuring. That will be followed forward as they complete their clinical trials, look at younger people in their clinical trials, and the rest will have to see how it tracks out. But I assume that there will be different vaccines being offered because there are, in fact, billions worldwide that will need to be vaccinated.
Right. That's a great point. Do we know how long immunity lasts with this particular vaccine?
So we don't really. We've seen the idea here is that although we now have data that tells us within 10 days antibodies were seen, both T cells and B cells, the idea between a 21-day booster, for example, think about your chickenpox vaccines, your measles, mumps, rubella vaccines. These are all given as a 2-series dose because the first one primes the immunity, the second one gives you more sustained immunity. So it's hard to know whether it will be a year or 2 years, whether this will be annual like a flu vaccine, the coronavirus vaccine. That's data that will roll out as we go forward. But we do know that in terms of the short-term protection, the data is looking very good. And if you look at other messenger RNA viruses, for example, measles is a similar type of virus. We know that our 2-dose schedule offers long-term immunity. But that data is not known yet, and that is data that will evolve as we continue with post-market surveillance.
Sure. To modernize it a little bit, Dr. Marla, for my demographic, a lot of our viewers' demographic, the shingles vaccine is a great example. First dose, and then you wait, and you get the second.
Yes, that's exactly the same type of 2-dose series. And much in the same way with the shingles vaccine, you can get a very large local reaction. You can feel flu-like and a little bit under the weather for a few days. It's important to understand what the anticipated side effects of the vaccine are so that you understand that if you have this type of reaction, I always tell patients, you're listening and watching your immune system in effect. Right. So the type of side effects that we've seen with this vaccine have been local reactions more than anything, or a flu-like illness. And that is to be expected with many vaccines and doesn't necessarily represent a serious adverse event. We've not seen serious adverse events, and that's data that's being looked at as we speak by the FDA today.
30 seconds left, Dr. Marla, to give me an example of what you would say to someone who is extremely hesitant, might even refuse to take the vaccine.
Right. What I would say is that firstly, for everybody, this doesn't mean that we should stop wearing masks. We need to keep up our mitigation strategies. Vaccines work better if the numbers are low. And I think we do have to listen to concerns. We don't have all the answers, but to understand what a messenger RNA vaccine is all about, the type of results we're seeing, and this really does represent our best opportunity to protect not only you, but the people that you come in contact with should you be an asymptomatic carrier. So getting a vaccine is not only good for you, but it's good for society as a whole.
From Toronto, CTV News medical specialist Dr. Marla Shapiro. Thank you as always, Doctor.